Uh, my name is my name is Barrington here, and I am the product manager. Quick introduction for your presenters. We also have May, our marketing manager here at Hino. So just a quick disclaimer on RTM that the following information is provided based on interpretation from CMS and APTA guidelines on remote therapeutic monitoring. In this, we'll be going over generalities of RTM for remote therapeutic monitoring, and then later on, we'll be going into spotlight of Hino itself. So, what is remote therapeutic monitoring, or abbreviated as RTM? Remote therapeutic monitoring promotes providers to bill for reimbursement of remote management of patients that are being treated for musculoskeletal and respiratory conditions using medical devices to collect data. Why to consider RTM in your practice? Reimbursements vary in range between $150 to $275 per patient per 60 days. There is better patient care as an output for better engagement with the patients. And in several cases, practices are already doing RTM without getting that reimbursement for services that they're currently already providing to patients. And so, why is RTM important? Uh, the prescription of home exercise programs have been in place as a standard to maximize patient results with their rehabilitation and therapy. Until now, there's not been a direct incentive for these extended services that occur with patients between sessions and that focuses on patients completing their home exercise program. Secondary to the importance, RTM can provide better patient results, satisfaction with services, and extend patient retention. It's a new step in connecting healthcare with the aid of digital devices that promotes and drives results for the community. So, who can necessarily bill and participate in RTM? It's available for physical therapists, physical therapy assistants, occupational therapy assistants, and speech language pathologists. In terms of potential revenues, there are five codes that we'll be looking over today. Among those include CPT code 98975, which is device education and onboarding, which is a reimbursement around $20. The CPT code 98976, which is the device supply of respiratory systems. That coincides with CPT code 98977, device supply of musculoskeletal systems. Those two codes, either or, represents around $60 per month. CPT code 98980 for remote treatment initial 20 minutes, averages around $50 per initial 20 minutes. And then CPT code 98981, remote treatment additional 20 minutes, $40 per additional 20 minutes, where month one estimate is around $130 and month two is around $150, totaling $280.
Raise your hand if you could use another $280 per patient episode. We love to see those hands raised.
Touching into the individual codes now, CPT code 98975 for device education and onboarding. This CPT code is where in remote therapeutic monitoring, for example, respiratory system status, musculoskeletal system status, therapy adherence, therapy response, initial setup, and patient education on use of the equipment. How often can it be billed? Is once per episode of care. In this example, for this CPT code, this is where interaction and engagement with the patient to inform them uh, of their RTM for their monitoring and getting them initially set up through their devices, whether it be through their portal account or for instance, through our new features, for instance, for patients to receive an email to complete their exercises as well, that they'll be aware of how to access their information and what is required on their end to mark the exercises as completed. CPT code 98976 for device supply. Uh, CPT code 98976, remote therapeutic monitoring devices supply with scheduled recordings and or programmed alerts transition to monitor respiratory system each 30 days. How often can it be billed is 30 days upon activation. So this tracks upon the activation date itself of the patient, 30 days within that window. So if they were activated today, uh, June 24th, it would be a 30-day window between that time frame. And then there's CPT code 98977 for device supply. This is remote therapy monitoring device supply with scheduled recordings and or programmed alerts transmission to monitor musculoskeletal system each 30 days. And how often can this be billed is 30 days upon activation. In this instance, it is similar to the previous CPT code of the 98976. However, this is tracking for musculoskeletal system itself each 30 days. And again, same process is that if patient was activated today, June 24th, 30 days would be the window for how often this code can be billed each 30 days. CPT code 98980 is for remote treatment. This is where remote therapeutic monitoring treatment management, physician, other qualified healthcare professional time in a calendar month, requiring at least one interactive communication with the patient caregiver during the calendar month for the first 20 minutes. How often can this be billed? Is once per initial 20 minutes in a calendar month. So with this CPT code, this is where you have the ability to bill out this individual unit once per calendar month for the initial 20 minutes. And CPT code 98981 is for remote therapeutic monitoring treatment management, physician, other qualified healthcare professional time, and a calendar month for each additional 20 minutes. This can be billed after the additional 20 minutes have been billed in the calendar month. So each additional 20 minutes that is being involved with the patient after the initial 20 minutes have been expended, the additional 20 minutes from there is where this can be billed throughout the calendar month. So we have some FAQs here that we wanted to go over. And CPT code 98980 and 98981 remote treatment be billed if the patient does not log in, log 16 out of the 30 days? And the answer is yes. In many cases, providers are actively creating and updating the patient's HCP, connecting with them outside of their appointments. And that is where, by tracking the minutes that they are spending with engagement in that patient, whether that be through the video call, phone call, telehealth connection, or updating the HEP, for example, that is where those minutes do count towards the 98980 for the initial 20 minutes and the 98981 for the subsequent additional 20 minutes. So that is where the requirements are fulfilled for those two codes compared to the patient not logging the 16 out of 30 days requirements for the other codes there.
We'd like to ask again by raising hands, who is already handing out home exercise plans? Beautiful. If you're already handing out home exercise plans with all the information that Barrington has shared so far, RTM might be a feature that you want to look into adding to your Hino software.
How is interactive communication defined? Remote communication, such as a phone call or telehealth virtual visit, is how that interactive communication is defined. So contacting that patient via those methods there. is how you meet those interactive communication requirements. Which payers are currently reimbursing for RTM? Currently, only Medicare is officially confirmed to be for reimbursement for the services. However, we have heard that Medicaid and many other commercials are already reimbursing. So it is generally recommended to contact your payers at provider services directly to find out if they are reimbursing for your state itself. Are RTM codes subject to the multiple procedure payment reduction, also known as MPRR? No, currently RTM codes are classified as sometimes therapy codes. That, however, they will count towards the annual KX threshold. They are not subject to MPRR. Are the RTM codes subject to the PTA COTA payment differential? Yes, RTM codes 98975, 98980, and 98981 are subject to payment differential. However, 98976 and 98977 are not. So, in summary here for RTM benefits, from what we've seen, national offset, there's a 70% POC for plan of care graduation failure rate with better patient engagement. There is not a steep learning curve, so there's no third-party software required, being that it's under the Hino umbrella there. There is increased provider profitability with RTM right inside of your EMR. There is a greater revenue potential for monitoring patients remotely and answering their exercise questions directly within your EMR itself. We do want to mention that reimbursements will vary upon state and local fee schedules and therapists and patient RTM activity volumes itself. In terms of cost breakdown for those utilizing Hino, subscription based, there is a $25 per month per therapist and $10 per active patient enrollee. And for those participating with our RCM program, it is $25 per month per therapist and $5 per active patient enrollee. And we do want to mention that not all therapists in the clinic need to utilize RTM, and not every patient needs to be active. So there is flexibility on the practice level to determine which provider would like to utilize RTM with their patient engagement and selection for which patients may be best beneficial to utilize RTM inside of their clinic itself directly.
Thank you, Barrington. That was a lot of insightful information. We hope you all learned something new about remote therapeutic monitoring today. If anyone has any questions in regard to any of the information we just went over in our RTM slides, please open your chat and you can begin to ask your questions. We will have someone answer along as we go in order. Any questions we feel may need a little longer response, we'll answer towards the end of the webinar. At this time, we have completed the first half of the RTM webinar, and for the remainder of our time, we will showcase how to use remote therapeutic monitoring through the Hino platform. So follow along and learn how to use our feature in real time.
We'll go ahead and transition here into discussing RTM and Hino itself directly. And I do see we have a question in here regarding tracking time, and we'll be going over that in just a few moments here. To get started with RTM and Hino, you would need to have RTM active in your account, and the provider would need the RTM user privilege. This can be found under the Admin tab, under Users, and enabling the EMR RTM user by double-clicking onto it and moving it over on the left to the right. With that privilege added and saved into the user's profile, that provider would then be available for RTM activation itself. In terms of uh, adding a new patient activation, we'll go over to our patients page over here. We do have a dedicated report under your main patients page for RTM itself. Uh, so this gives you a good summary off of patients to see RTM if it's already been activated or not, or the RTM being active, when were they activated, for device activation, and if the patient is onboarded. To see that, we'll go ahead and select this patient here that does not have RTM active, and let's go ahead and get them activated. We'll click on our link here for RTM, and this will let us know here for the RTM patient dashboard. This you'll see once a new patient is getting ready to be activated. To activate the patient, there is a toggle over here. You would just click onto this toggle and click confirm that this will activate the patient and set you as the rendering provider in the patient record. Clicking OK provides that confirmation for activation. As you work through and onboard your patient for discussing with them options for them accessing their RTM. So for instance, whether if they have a portal account or if they'll be filling it out through the emails that are sent to them if they have not completed their exercises currently, selecting onto the activate onboarding, we'll go ahead and activate that section as well. And then lastly, for the activate device, to confirm that they have that device enabled, to have that in place. The last section down here is the monitor. This is where you're marking off whether this patient is being tracked for musculoskeletal or respiratory. Let's go ahead and select musculoskeletal. With this in place, this just goes ahead and lets the individual know that there are CPT codes to process, that it's, for instance, the 98975 for that education and onboarding. And that's where that processing pending CPT codes is available there. With the setup and education completed for our requirements met over here, the next section is in terms of patient activity. This is where the tracker will update based off patient's activity. In this case, being that it's a new patient, they don't have activity track, but in a few moments, we'll take a look at a current patient. We'll see their tracking record there. Part of the patient activity is where you'd be able to see and edit your HCP, as well as view activity from the patient's information. The activity log itself is on the far right here, and this lets you know for when you've met your initial 20 minutes for that have spent with the patient, and then the additional minutes connection with the patient as well. Let's take a look at how we could go ahead and set up an HCP in the patient themselves. We'll go ahead and get this patient checked in. And upon check-in, we'll go ahead and get their note started. HCP can be added either through the experience log for the daily note inside of the individual note itself, or through the experience log tab itself under your document tab on the left-hand side. For adding experiences to the HCP, this is where under the experiences section, clicking onto the add, I can go ahead and see HCP linked activities by enabling my toggle here and selecting onto the experiences. This is where I could search for an experience. Selecting onto the experience, this is where I could put in my details here. The HCP image and instructions is listed below, and I have the ability to edit the instructions to manage that for the patient individually. Selecting create will go ahead and add that experience in, and I could add in additional experiences as needed. And again, selecting create, we'll go ahead and add this in. Under the HEP tab itself, within the daily note, for example, this is where I could view the edit. So go ahead and update information to make it specific to my patient, as well as the amount details itself and order. There is also a option to send, whether through that page or here if you're ready to send directly. And this is where you have the ability to print and or email to the patient, depending on the individual needs for that patient. In terms of the HEP record itself, the printout itself generates, so then that way you can print it out and provide it to your patient. Aside from the email, it's send it over as an attachment. This document is also saved in the patient record. So should the patient misplace it or lose it or need you to uh, uh, generate another copy for them, it will be available to have that generated and provided to them. Now, if we take a look at the patient dashboard, we'll go ahead and take a look here to see what it looks like with a current patient. So for instance, with a current patient, this is where we're able to see the details for that. They are been set up for the schedule and education for those requirements there, and the patient activity. As the patient completes the review of their HEP program and submits their feedback for it, this is where the tracker occurs. Uh, in this case, for instance, this patient was activated on the 10th of this month, and that's where the 30-day period ends on July 9th. So between now and July 9th, we would want to have that patient try to reach the threshold there. As the patient reaches that threshold, then this code would be able to be built. Again, in terms of viewing the HCP, that can be done by clicking onto the HCP button here. And this is where you can see what is currently connected with that individual patient for their home exercise program. And you can make any updates as needed, as well as adding an exercise in the upper right-hand corner. In terms of viewing the activity, this is essentially viewing the feedback off of the patient. So this is where we're able to see details off of if the patient had any difficulty, any pain, or any comments that they provided within that experience itself. The activity date is recorded for most recent, so as the patient completes and progresses their information, you'll be able to see those details as well. In terms of the activity log here, this is where you have the ability to add in minutes. So in this case, let's say that I had a video call with the patient to go ahead and check in with them to see how they were progressing, if they've had any questions or any details of information. And let's say that my call with them lasted 12 minutes. Selecting the create would go ahead and add that in. And this lets me know that I have had 12 minutes logged and I have 8 minutes next set. Let's say that I've also worked on their information, such as monitoring the time, set the activity date, and I updated this to 8 minutes, selecting the create. This lets me know that I have met my 20-minute threshold and I've met the requirement for that activity as well. In this instance here, it's letting me know that I have had a previous month of unbilled codes, and that's where I could go ahead and make sure that I have those months completed by selecting on the previous month here and process those pending CBT codes. For each additional 20 minutes that I spend with the patient, that's where this section over here would let me know that I have met those requirements. And once I've met those requirements for that target of the additional 20 minutes, it would go ahead and mark that I've completed those as well. One thing that we'd like to also mention is that CBT codes don't only have to be processed and billed through the patient's individual profile, but can also be done from the main report here as well. For patients that have codes eligible to be billed, pull up an example here. There'll be a bill now under the codes billable to let me know in green that this patient is eligible for codes to be billed, and I can go ahead and get those processed by selecting onto the bill now option. This will go ahead and create the encounter for billing to occur and process that for billing processes. Now let's go ahead and take a look at what it looks on the patient end. So just to mention again, patients have the ability to uh, complete their home exercise program feedback through their portal account. So if the patient has a portal account, they can complete it through this section here. Upon login, they'll be greeted with the home exercises to complete first thing in the upper left right here. Selecting onto that, this is where they have the details for their home exercise program. They would click onto the individual exercise itself, and then they could provide any feedback and details in this section here for any difficulty, any pain, did they complete, and any comments they would like to add. As they complete, it will remove from the list of exercises for them to complete, and that way they could focus on the ones that are remaining. And again, here, they could fill in if they had any difficulty, any pain, if they fully completed it, not completed it, or partially completed it, or if they did not attempt, and sending the feedback as well. So as that's completed, they have completed their exercises and they would not have any more there. If they would like to send a message to you, they have the ability to do so directly from here as well. This is where they could put in any details here. And sending it over. I'll just go ahead and create a new thread for that individual message section there. In terms of a mention about the reminders, part of the new features available inside of Hino for RTM is our reminder notice. In this case here, this is where a patient has as their RTM active and has an HCP linked with them. Clicking onto the link over here is where they could go ahead and view their exercise details. Inputting their date of birth, and selecting finish would then bring the patient into the exercises as well. So this is another alternative. So for instance, if you have patients that do not really want to utilize the portal and would rather receive the email for them for their exercises, this is sent to patients that have not completed their exercises for the day to alert them and have them be aware that they have exercises to complete and for them to go ahead and get those completed in place. So this helps with that 16 to 30 day requirement to build out the CPT codes to help reach those requirements for the reimbursements itself. And in terms of how would you go about activating the patient for a portal account, we'll go into a patient's profile here. You would need your patient portal enabled, and as that is enabled, then that's where there's a portal and add to patient option if the patient doesn't already have a portal. And that is where you can add them to the portal itself. For patients that are currently already have a portal, no additional setting would be enabled. That is where they would already have access and the exercises would display. For patients that already have that portal access, no additional setup is needed. It will automatically display once the patient has been activated for RTM and exercise is designated to them. In the upper right-hand corner, we do have our messages display, so it is available through the main RTM dashboard itself and in the upper right. This is where you'll be able to view messages from the patient and their information, uh, RTM would need to be activated for your account, and the patients would only be able to send RTM messages through the RTM uh, uh, dashboard through the portal or from that email itself directly. And now in terms of billing for billing out the codes itself, again, we have those details for whether they're generating the encounter within the individual's profile directly for billing out the CPT codes here, or from the main report, depending either or, whichever is easier to manage on the practice level. Both will generate the encounters for the patient. The encounters can be viewed from the billing tab under encounters. And this is where encounters would be generated for the individual patients to get those claims submitted over for reimbursement. Now, it is important to note that for these encounters, if the KX modifier is enabled for the patient, the KX modifiers would also populate onto these as well, as they do count towards the threshold. In terms of modifying the amounts that you'd like to bill out for these codes, that could be enabled and changed through your billing manage tab under the procedure codes here. And the procedure codes for the RTM, as mentioned, that 98975, 98976, 98977, 98981, and 98980 can be updated to the preferred billing amount, clicking onto the edit pencil here, and editing the CPT codes. And now we'll go ahead and go over our closeout information.
Thank you, Barrington. That was a very informative demonstration. It was very wonderful. Now that you have all seen RTM and Hino, if you are a current user and you're interested in utilizing the RTM feature in your clinic, please submit a ticket in our ticketing system and someone will get back to you. If you came here today from an ad or a post and you're interested in learning more about Hino and RTM, please visit our website and click the Book a Demo button. Our website is www.heno.io. Or if it's easier, you are more than welcome to reach out to us on whichever platform you found today's webinar, and we will direct you to how you can book your personalized demo experience and get you started. Now, if you want to stick around for the remainder of today's feature webinar, we see that there are some questions in the Q&A. We will go over those remaining questions that we have left. This webinar recording will be available later today to share with others in the clinic if they were not able to attend today as well. And thank you everyone for joining us.
Thank you, everyone. We'll go ahead and start going through the list of questions now that we have. We see one here for, do we have a handout, an exercise program through Hino? We still use HEP to go. If so, how do we track time for putting together the HEP? So for that two-part section there, yes, Hino does have an HEP program built into Hino. The HEP can be updated and sent over through the patient's daily note or through the experience log itself. If you wanted to create your own HEP, that is also available under the settings. Once you have experiences set up for the patient, or if you want to create an experience through your HEP, that can also be done. Within the HEP section over here is where you can create an HEP if not already in the library. This is where you could give it a name to the HEP as well as patient exercise instructions. Linking to an experience, whether there's an existing one that you want to link it to or add it to a new experience, you could give the experience a name. Either uploading an image that is a JPEG 4 megabyte max, you could upload that, or a video snippet, a 10 megabyte max as well. The rotation here is just in case you need to pivot your picture for uploading it if you've uploaded it in a different preferential setting. And then the disclaimer, you just type in the words yes to confirm that the image that you're uploading is not copyrighted. And if the patients have been pictured, that they've given consent to those materials, and any internal notes that you would like recorded. In terms of tracking the time for those details, that would be done through the RTM section itself within the individual patient's profile under the activity log on the right. This is where you would click on to add and selecting the activity type that you are coordinating and doing so with the patient, for instance, the monitoring time, reviewing HEP, setting the date and the duration for the amount of minutes that you've put together for either putting together the HEP or reviewing the HEP itself for the monitoring time. There is a question here for what is RCM. In a previous slide, I mentioned $5 per patient enrollee, while subscription was 10 patient. RCM is our revenue cycle management program. This is for clinics where they're having Hino complete the billing for them. Depending on if you're participating in our subscription program or our RCM, that's where the pricing does have that differential there. Do patients sign up during therapy or only after discharge? So this is typically done at either the initial session with the patient or that secondary visit, where providers can go over the details of the RCM with the patient and their home exercise program. This sometimes the patient can still be working through their RTM past the discharge with the patient. So that is where typically it is done again in the beginning of their treatment for their plan of care. That way, the reminders, like for instance with the emails that go out to complete their exercises, can be done and help improve the patient's commitment through the plan of care to help their progress their patient goals. There's a question for the chat function is available, if it is available. On that, in order for it to be available, RCM does need to be activated for your clinic account. If it is activated for your account and you're getting an error message, we do ask that you contact our support team for those currently live utilizing Hino or onboarding if you're currently getting started with Hino. There's a question here for, are patients required to give a response to every exercise every time or 16 times a month? In that instance, patients are required to give a response to all of their exercises for their HEP. And they do need to do those responses at least 16 times per month. So once that threshold is met, that's where those codes are available to be billed for the individual patient. If we take a look at our patient here, this is where we could see if they've met the threshold for if they've been active or not and how many days remaining. So if this patient completes their remaining days, that's where we could go ahead and complete the billing for the patient activity between those days. Viewing the activity, this is where the activities can be viewed to see what have they completed on the activity date for information if they've had any difficulty paying and any comments on the exercises directly. There's a question here for portal access is a different feature. Yes, the general store is required for the patient portal to be enabled. So the general store is a requirement for the portal itself in order for the patients to have those completed there. There's a question here for if they were to use an outside source like HEP to go. The Hino RTM platform is primarily built to utilize HEP program within Hino itself, as it's used to track that information. If you were only using Hino to not track the patient activity and only use it for the setup and education and activity log, that could be done so through setup and education by activating the patient. as well as the activity log for viewing and adding in minutes to record that time. But the patient activity then would not be able to be tracked, and then you would be missing out on that reimbursement as that's not completed through HINA. There's another question between for is there any amount of time between in-person and RTM visits? Example, one visit a week with one check-in, or one visit every other week and monitor in between. Uh, that kind of varies on the individual patient. In some cases, the patient may have multiple visits per week, and maybe you're doing a check-in call with them in between those visits uh, uh, to make sure the patient is completing their exercises and progressing with them. So in that scenario there, I would say that typically the monitoring would occur between visits, and there's not a set definitive on that. But when you are contacting the patients and either through call or video call or such as, you would want to be sure that you're recording your minutes in order to get that reimbursement. Because again, even if the patient did not complete their activities for the 16 out of uh, the 30 days there for the tracker, you can still receive reimbursement for the activity log time for the initial and the subsequent 20 minutes, um, for those additional 20 minutes that you spend with the patient. So you can still seek that reimbursement for those two CPT codes there. And we'll just give a few more moments now if there are any additional questions in the chat or Q&A. Uh, go ahead and type those in. We can go ahead and get those answered for you. Is there a limit of how many months the patient can do this? Um, it would vary on the patient's episode. For example, depending on the length that you're seeing the patient for, uh, is where there's those definitive guidelines for how often can be billed. So, for instance, for the episode itself, that's where the setup and education code can be billed once. The patient activity code uh, uh, for this tracker between the 16 out of the 30 days is based off of the date range itself. Um, so in that instance there, the the patient would need to complete those 16 out of the 30 days in order for uh, reimbursement to be able for the patient activity tracker for those codes. And then the activity log itself is based off of the calendar year, based off of the 30 days. Um, can you track people you have never seen in the clinic, like Medicare patients who live out of the state? Do they need a referral for RTM? Um, in uh, in that case, I do believe a referral is needed. However, in that case, there I would recommend contacting Medicare's provider services to confirm if you can utilize RTM for patients that are out of state if you haven't seen them in the clinic. And there's a question here about uh, portal. If the portal is not active, can they monitor through the email? Uh, we'll check on that and confirm via our ticketing system to confirm that question there. And I do not see additional questions in the Q&A there. But in case anyone does have any additional questions regarding RTM or wanting more information for adding RTM into your account, we just ask that you send over a ticket through our ticketing system for those currently active and live utilizing Hino through our support team, or for those currently getting started with Hino through our onboarding team. Thank you very much, everyone, for your time today. And we hope you've been able to learn something new about RTM here, as our goal here at Hino is to always streamline the practice and impact communities. Thank you, everyone, and we hope you have a wonderful day ahead.